A well-balanced and nutritious diet has many benefits. Trust me, this video is very amazing for you. Now let's start the video. On the other hand, a diet lacking in nutrients may cause various unpleasant symptoms or even serious adverse effects. These symptoms are your body's way of communicating potential vitamin and mineral deficiencies. Learn about 5 common signs of vitamin and mineral deficiencies and how to address them. 1. Brittle hair and nails. A variety of factors may cause brittle hair and nails. One of them is a lack of biotin. Biotin, also known as vitamin B7, helps the body convert food into energy. A deficiency in biotin is somewhat rare, but when it occurs, brittle, thinning, or splitting hair and nails are some of the most noticeable symptoms. Also, the prolonged use of antibiotics and some anti-seizure medications is a risk factor. Eating raw egg whites may cause biotin deficiency as well. That's because raw egg whites contain avidin, a protein that binds to biotin and can reduce its absorption. Foods rich in biotin include eggs, organ meats, fish, meat, dairy, nuts, seeds, spinach, broccoli, cauliflower, sweet potatoes, yeast, whole grains, and bananas. Adults with brittle hair or nails might consider trying a supplement that provides about 30 micrograms of biotin per day. However, it's important to speak with a healthcare professional first before beginning any new supplements. 2. Mouth ulcers or cracks in the corners of the mouth. Lesions in and around the mouth may partly be linked to an insufficient intake of certain vitamins or minerals. For instance, canker sores, a type of mouth ulcer, are often the result of deficiencies in iron or B vitamins. In a small older study, around 28% of patients with recurring mouth ulcers had deficiencies in thiamine, vitamin B1, riboflavin, vitamin B2, pyridoxine, vitamin B6, or a combination of the vitamins. These findings indicate that there may be a link between mouth ulcers recurring and deficiencies in these 3 vitamins. Foods rich in iron include poultry, meat, fish, legumes, dark leafy greens, nuts, seeds, and whole grains. If you experience these symptoms, consider speaking with a healthcare professional. They can evaluate your situation and create a treatment plan to address your medical needs. For example, they may order tests to determine if you have any vitamin or mineral deficiencies. If so, they may recommend adding or increasing the dietary amount of certain foods or starting supplementation. They will likely monitor you to see if your symptoms improve. 3. Bleeding gums. Sometimes a rough tooth brushing technique is at the root of bleeding gums, but a diet lacking in vitamin C can also be a contributing factor. Vitamin C plays an important role in wound healing and immunity, and it even acts as an antioxidant, helping prevent cell damage. Your body does not make vitamin C on its own, so the only way to maintain adequate levels of it is through diet. Vitamin C deficiencies are rare in individuals who consume enough fresh fruits and vegetables. That said, many people do not eat enough fruits and vegetables each day. Consuming very little vitamin C through your dietary selections for long periods can lead to deficiency symptoms, including bleeding gums and tooth loss. Another serious consequence of severe vitamin C deficiency is scurvy, which depresses the immune system, weakens muscles and bones, and makes you feel fatigued and lethargic. Other common signs of vitamin C deficiency include easy bruising, slow wound healing, dry skin, which may become scaly, and frequent nosebleeds. To consume enough vitamin C, it's important to eat at least 1.5 to 2 cups of fruit and 2 to 3 cups of vegetables each day. 4. Poor night vision and white growths on the eyes. A low nutrient eating plan can sometimes cause vision problems. For instance, low intake of vitamin A is often linked to a condition known as night blindness, which reduces your ability to see in low light or darkness. That's because vitamin A is necessary to produce rhodopsin, a pigment found in the retina of each eye that helps you see at night. When left untreated, night blindness can progress to xerophthalmia, a condition that can damage your cornea and ultimately lead to blindness. Another early symptom of xerophthalmia is bitot spots, which are slightly elevated, foamy, white growths that occur on the conjunctiva or white part of the eyes. Bitot spots may improve within 2 weeks of high-dose vitamin A therapy, but it's important to speak with a medical professional before making any significant dietary changes. Vitamin A deficiency is rare in developed countries. If you suspect your vitamin A intake is insufficient, you might consider eating more vitamin-rich foods, such as organ meats, dairy, eggs, fish, dark leafy greens, and yellow-orange colored vegetables. Unless you're diagnosed with a deficiency, it's typically recommended that you avoid taking vitamin A supplements. That's because vitamin A is a fat-soluble vitamin, which when consumed in excess, can accumulate in the body's fat stores and lead to toxicity. Symptoms of vitamin A toxicity can be serious and include nausea, headaches, skin irritation, joint and bone pain, and in severe cases, even coma or death. 5. Scaly patches and dandruff. Seborrheic dermatitis, SB, and dandruff are part of the same group of skin disorders that affect the oil-producing areas of your body. Both involve itchy, flaking skin. Dandruff is mostly restricted to the scalp, whereas seborrheic dermatitis can also appear on the face, upper chest, armpits, and groin. The likelihood of these skin disorders is highest within the first 3 months of life, during puberty, and in mid-adulthood. Studies show that both of these conditions are very common. Up to 42% of infants and 50% of adults may experience dandruff or seborrheic dermatitis at one point or another. Many factors can cause dandruff and seborrheic dermatitis, one of which is a nutrient-poor diet. For instance, low blood levels of riboflavin, vitamin B2, and pyridoxine, vitamin B6, may play a role. While the link between a low-nutrient diet and these skin conditions is not fully understood, people with dandruff or seborrheic dermatitis might consider consuming more of these nutrients. To confirm whether you have a deficiency, you can talk with a healthcare professional who can order tests to check your vitamin levels. Foods rich in riboflavin and pyridoxine include poultry, meat, fish, eggs, dairy, oats, nuts, and certain vegetables. A diet that provides an insufficient intake of vitamins and minerals can cause several symptoms, some of which are more serious than others. Increasing your intake of foods rich in the appropriate vitamins and minerals may help you manage nutrient-deficient-related symptoms. However, it's always helpful to speak with a healthcare professional before making significant dietary changes and if you're considering supplementation.